90+% of people being hospitalized today are unvaccinated or partially vaccinated. Almost nobody who's vaccinated finds their way into the hospital today because of COVID. These vaccines are working.
You're listening to A Second Opinion, your trusted source engaging at the intersection of policy, medicine, and innovation, and rethinking American health. This episode is brought to you by the Blue Cross Blue Shield Association. Blue Cross and Blue Shield companies are in every zip code in every state, working to improve health and expand access to care. Community by community for the health of America. Dr. William Schaffner, a familiar and nationally recognized face and trusted source on all matters COVID during the pandemic, is an infectious disease colleague of mine when I was doing heart and lung transplants at Vanderbilt University Medical Center. Today, he is medical director and past president of the National Foundation for Infectious Diseases. He's professor of preventive medicine in the Department of Health Policy and professor of medicine in infectious diseases at the Vanderbilt University School of Medicine. A little over a year ago, Dr. Schaffner joined us as one of the nation's leading experts in infectious diseases to shed light on the novel virus we now all know too well, COVID-19. Today, he's joining us again to share all that we've learned, what we're still learning, what we can anticipate, and how this record-setting scientific progress is changing the future of science forever. Stay tuned, and together we will learn a lot. I'm your host, Senator Bill Frist. Welcome to A Second Opinion. Bill, it's great to have you on the show with us once again. It was a little over a year ago that you were joining us as one of the nation's leading experts in infectious diseases to help shed light and explain a lot about the novel virus that we all know too well as of today, COVID-19. And it was, I think, late March 27th. And now 15 months later, we're reconnecting on a lot of topics. Let's take some current topics up front, talk about things, the new variants, where we are today. And then let's go back and talk a little bit about how things have changed and what we've learned over that time. And probably most importantly, how we can do better in the future. So let me open. It's now midsummer. People are excited to be back to work, to play, to go out to dinner, to go to the movie theaters. They're gathering in large groups, indoors and out. Not many people wearing masks or social distancing anymore. There's this relief that we all had that this pandemic may be coming to a close. A lot of people acting as if it's all over, that we can declare victory. But at the same time, this is where I want to sort of dive. We hear of the Delta variant infecting people all over the world. And yesterday I was reading about an even more worrisome variant emerging in India. So what do you make of all this? The great relief we all have that we're making progress, maybe a rush back to normalcy a little too early. At the same time, we have this juxtaposition with these new variants, much more transmissible than the COVID-19 that we all know.
Well, Bill, first of all, it's good to be back with you. And we do have a year's or more now perspective on things. But to hone in on the current situation, I think even we infectious disease and public health docs are of a bit two minds about this. The first is, yes, the vaccines are permitting us to get a better handle on COVID. There's no doubt about it. But the other side of that coin is we can't unfurl the mission accomplished banner just yet, by no means, because we've discovered that this virus can mutate, can throw off variant strains that have somewhat different characteristics. And this Delta variant is extraordinarily transmissible, contagious. And it's now becoming rather quickly the dominant strain here in the United States, or soon will be. And That means it's honing in at the present time, Bill, on people who remain unvaccinated. So it's useful to look at who's now being hospitalized. I mean, the vaccines were designed to prevent serious disease and hospitalization. So who's being hospitalized today? This is true at the Vanderbilt Medical Center, right here where we are, as well as across the country. 90+%, this is important, 90+% of people being hospitalized today are unvaccinated or partially vaccinated. Almost nobody who's vaccinated finds their way into the hospital today because of COVID. These vaccines are working. So if you're unvaccinated, you're still at risk. And the second thing is, remember, when we talked a year and a half ago or thereabouts, most of the people hospitalized were older. Now, most of those people are vaccinated. And the people we see in the hospital unvaccinated are middle-aged and young adults. And so
Yeah.
the notion is, yes, they're less likely to become sick, but they can become just as sick as someone who is 72 years old.
So people right now are listening to us or watching us, probably in all 50 states right now. Is the Delta variant in all likelihood around them right now?
Oh, you bet. It's everywhere. It is so contagious, and it's on the upswing simply because of its contagiousness and because there's still such a reservoir of unvaccinated folks out there.
And let's say I have the Moderna vaccine, Moderna and Pfizer vaccines, 2 doses, mRNA vaccines, and then you have the J&J vaccine. Is there, I'm beginning to read and hear more about the differences, but anything definitive yet in terms of which is more protective against the Delta variant, which is about twice as transmissible, and correct me on this, but about twice as transmissible, but is there any difference in those vaccines?
This is all rather still preliminary, but it looks as though the Pfizer and the Moderna vaccines, those mRNA vaccines, still do provide about 90% protection against serious disease. The data on J&J is not as good after all. Much less of that vaccine has been used. It's high, but maybe not quite as high, in the high 80s.
Yeah.
So the vaccines we have really are still very good against this Delta strain.
So the message, if you hadn't been vaccinated, get vaccinated. The message to, the oversimplification, the message for these variants, and each variant's going to be a little bit different, but for the Delta variant, I'm reading, we have to be very careful what we say. Now we're in late June. So before anybody does anything, you need to check what happens, 3 days from now or 10 days from now. But it sounds like that some people are suggesting if you have the J&J vaccine and the Delta variant, is highly prevalent in the area, whatever that means, that you might consider getting a booster with one of the mRNA vaccines. It's probably too early to recommend that, but is that the sort of thing that you're hearing as well?
I've gotten that question just this morning, and it is coming in with great regularity. I can tell you that so far, the CDC's Advisory Committee on Immunization Practices has not seriously considered that. But I think this question is coming in so frequently, they're going to have to address that pretty darn soon.
Yeah, and I think that the point is this thing's not over. I don't care what age you are, what you're doing. We're all so relieved that things are so much better than they were because of these miraculous vaccines. But these variants are popping their heads up, and they behave differently, and it means that we're going to need to respond appropriately. So we need to stay prepared in so many ways and follow the science. And when the recommendations are made, make sure that we do respond to those. What about other variants, Dr. Schaffner? The one in India right now, again, it's really early, but in just reading sort of globally what people are reporting, which looks like it's much worse than the Delta variant. You can either comment on that, but more importantly, are there going to be lots of other variants, crystal ball, a look over the next year, 2 years?
So I know, along with you, we're just learning about this Delta 1 variant, which is another variant of Delta that's coming out of India. And so we don't know very much about that yet. But, you know, every time this virus multiplies, infects a new person, it multiplies not only millions, but billions of times. It can mutate. And most of these mutations are harmless. They don't mean anything. But every once in a while, a mutation or a series of mutations together can produce a variant, a strain that has somewhat different characteristics than the parent. It's like children. They're of us, but they're different from us, right? And they have their own personalities and skills and talents. And these variants, no matter where they appear, whether in India or China or wherever, England, they can come here. So not only are we dealing with the issue of COVID here in the United States, but it is a pandemic. And the definition, as you well know, of a pandemic is a global epidemic. And the world is so small today that it's in our self-interest, beyond our humanitarian interest, but our own self-interest, to try to diminish as much as possible this pandemic around the world, because those variants can be here in a heartbeat.
You know, this sort of global responsibility is so important. And I was looking at it's either Commonwealth, maybe Kaiser poll yesterday of people around the world that said that the World Health Organization is still the most respected. You know, for political reasons, it gets sort of, you know, muddy. But if you ask people around the world, it is the World Health Organization. And whether you agree with that or not, it does drive home exactly what you said. We have a responsibility as a member of the global community, sort of being a human being and a responsible human being, to pay attention and support, whether it's science or information, with countries around the world. The virus has no borders, as you have said many, many, many times before. You know, tell me one thing on the 95% effectiveness and 80% effectiveness and statistics. What is the best way for the average person who has been vaccinated, say with Pfizer or Moderna, and people say it's 95%? If you have 20 people in a room, they've all been vaccinated, and the virus walks in and sort of taps on every one of those 20 people, and 5% is, you know, 1/20th. Does that mean one of those people would get infected?
Well, think about it this way. Suppose I expand your room a little bit and I put 20 vaccinated people in the room and 20 unvaccinated, and they all get exposed. Well, if the 20 unvaccinated people all get sick, only one of the vaccinated people will get sick. How's that?
Good. That's simple. That makes it easy. That's why you're such a great teacher, and I have been for such a long time. Now that's helpful, but it does mean that, you know, 1 out of a 20 chance, and again, these are aggregate statistics, so it could be higher than that. Even if you have the vaccine in your arm, if that virus, whether it's a Delta or, you know, the subtypes or just straight up COVID-19, there's still, you know, a 5% chance or a 20% chance or a 30%. And as an individual, it's always hard to play the statistics, but the whole point is, even though you've been vaccinated, you are still susceptible. Does the Delta variant, so let's use that 95% figure now that I understand it. Does the Delta variant, for those other 19 people in the room who have been vaccinated, is it more transmissible? Is it breaking through those 19 people more? Something about the vaccine itself, or the vaccine just not protective against that for certain people?
See, as usual, the surgeon gets to the heart of the matter. So some of the data that's now accumulating, and it's very, very early, it raises the question, although we're protected from serious illness by the vaccine against the Delta variant, could the Delta variant nonetheless still infect us? We feel fine. And could we be transmitters? Could we be spreaders to others? And that question is still under investigation. It's still new, but there are some data to suggest that at least some of the people, although they're vaccinated, they get infected with Delta, they stay healthy. The vaccine's protecting them from illness, but they could get infected and spread the virus to other people. That would be good from the point of view of protecting the individual, but we would have a gap there from the public health perspective, right?
Yeah.
Because you could still spread that virus to others.
In spreading and super spreaders, I opened with this whole image that we're all so excited about getting back to some sense of normalcy. And with that, we sort of say we've won. We can go back and we can be normal. And I was at an event on Sunday, a cookout with a very good friend here, and there were a number of people from the music industry there, which is one of the great, really valuable assets of Nashville, Tennessee, Music City, USA, and they were asking me, how should they feel? The concerts, these live venues, which capture all of this going back to normalcy and music, and we've won. As we come into September, there are hundreds, thousands of concerts being planned to catch up for the last 2 years, and people are excited to go to them. These are large venues of 20,000, 30,000, 80,000, 100,000 people. This is September, and at the same time, we're talking about, death, hospitalization, variants, breakthrough on vaccines. Is there any generalization or any statement that can be made? You can't say, no, don't do that. But the potential for a super spreader of a Delta or the new virus in India to go to one event with 100,000, 80,000 people sitting side by side seems to me a real risk. And any general comments? There's no solution to that, but any general comments? I didn't know what to say when they grabbed me over barbecue to comment on that.
Well, I have a big yellow light out there. That's the caution light, not the stop, also not the green. And I guess if I had a model, I would look to Bruce Springsteen. He's back on Broadway.
He's back.
But if you want to see his show, you have to show proof of vaccination. Then you can get into the theater. That would be my ideal way of doing this.
Mm-hmm.
I'm sure it's not practical, but if I had a druther, that's the way I would go. A lot of these concert venues, fortunately, are out of doors, but there are so many people jammed together for such a long period of time, and they're so exuberant. They're cheering and singing along and doing things. It's still going to be very hazardous. And I would say, if you are in any way immunocompromised, if you have any underlying illness, diabetes, heart disease, lung disease, if you're older, if you have some gray hair, maybe you ought to watch that on YouTube instead of going to the venue. It's my yellow caution light, right? We're not at mission accomplished by any matter of means.
You've been so effective initially when I came back in the transplant world back in the 1980s to Vanderbilt. You were right there articulating, immunosuppressive infectious disease, putting it in perspective, and you do a outstanding job because of your communication skills and explaining science. I'd love you just to comment. I think the political figures looking ahead, in a bit we'll talk about the past, but in looking ahead, I think our governors, our political figures, our mayors are going to have a really hard time, harder than in the past, and they've had a hard time in the past, slowing people down. articulating well long COVID, what that is, what the implications are of a new variant that comes through, that might come through in August or September, or explaining the Delta variant of potentially slowing people down. Not that you said that, but requiring that you have proof of vaccination, or that you must wear a mask. I just think in this environment, it's going to be tough for the political figures, because they're going to follow. They're going to want the vote. They're going to want to please their communities, the American people. They aren't going to want to say the tough message. The flip, and not the flip side, but you have the medical community, which you represent. I represent to some extent. Basically, with the reality of the science as it unfolds in real time, like it is in India, like it is across the world, in countries that have not been vaccinated to the degree that we have. How does this play out? You have more experience with it than anybody I know, because you've been at it for 40 years, communicating these complex scientific theses and thoughts coming in. But the political figures aren't going to want to do it. How do you put it together? What advice? How do you see it playing out?
Well, first of all, I'm together with you. I think political leaders have a very, very hard time. But I think they ought to, first of all, have confidence in public health leadership and base policies on science. Now, how do you actually implement that? I would accentuate the positive. Let me be frank. You and I are here in Tennessee. We're called the Tennessee Volunteers. I haven't heard from our political leadership a stirring call to action. I want all Tennesseans to volunteer to be vaccinated. I want us to be the most vaccinated, most protected state in the country. All of those are positive messages. I would reach out to the religious community to have the religious leaders of all faiths join into that. Where's the business community? The Better Business Bureaus, the chambers of commerce, they should be lining up behind those messages and all singing in harmony, positive messages. If we all get vaccinated, that's good for us as persons, but it's good for our neighbors, our communities. It's a safer place to raise our children. I mean, those are all positive messages. And I haven't heard them nearly as loudly as I would like. I would love to see a 50-state competition to see which state gets to 96% vaccinated the fastest.
I love it. I love it. And I think Tennessee right now, are we the fifth worst in America in terms of vaccination rate? I think that's right. I don't know. Yet we do have I talked about the music industry here. We're at least in the top 3 cities in America in terms of songwriters, entertainment. We always say we're the first, but I think we're the first. But we're the top 3, and that voice of being able to reach people emotionally and otherwise, as stars, as entertainers, as people who emotionally connect every day. You've had that industry. You have the sports industry with our sports teams all across Tennessee and our professional sports, coupled with where we started, our political leaders. And I think, I'm listening carefully because of what you've said. You said it 10 times, positive messages. It's not, you're bad for not doing it. It's that positive, affirming message is the one that captures those teachable moments. So I love it.
Bill, who did it beautifully. And you'll remember, Dolly Parton, her little piece was wonderful, charming, terribly effective. She said it so nicely and just hit every positive note, being an advocate for vaccine.
Exactly. A perfect example, affirmative, positive, constructive, and people listen. A lot more than they do to me as a doctor, you as a doctor coming in. Anyway, so we all have a big role in the big things. This thing's not over, it's not over. And we all have a role to play.
And now a quick word from our sponsors that make this podcast possible.
The United States has the highest maternal death rate of any developed nation, and racial disparities are a key factor. That's why Blue Cross and Blue Shield companies are confronting this crisis. They've launched a multi-year nationwide health equity strategy, starting with the goal to reduce racial disparities in maternal health by 50% over the next 5 years, building a more equitable system for the health of America. And now back to the episode.
I know long COVID is another issue that's a current issue. It's being defined. It's still nebulous in terms, not nebulous, we know what it is, but in terms of the size of the problem. We know that people of color and others of vulnerable populations, other vulnerable populations, have been disproportionately impacted by the virus for all the reasons that we know, we talk about. I think people are addressing well, but we need to address it even better. What is long COVID? What do we know about it today? How important will it be in the future, both from a medical treatment standpoint and how it changes medical practice? Because we really haven't seen it to the degree that we're going to see it before in the future.
So long COVID, we get infected with the virus. Some of us get very sick, some of it's hardly at all. But this virus does some strange things that we still don't understand. After we get over our acute infection and we think the virus leaves our body, it's made some changes in our body such that some of us will have persistent symptoms of one kind or another. Mental confusion, aches and pains, arthritis, just feeling down and not being energetic enough, some having some residual heart disease after having been infected. So this can go on not just weeks, but for months. And some people, and we're just defining this now, perhaps for a long period of time. And major academic medical centers see this as a sufficient problem. So they're establishing long COVID clinics. We're having one of those at Vanderbilt as we speak. And we're all trying to learn why this is happening and trying to learn better how to help patients manage with all these symptoms. This is going to be a problem for many people into the future. It will have economic implications for medical care. These people will be seeing practitioners of various kinds, helping them cope with these illnesses, these symptoms.
And is the medical profession generally doing a good job, or is it? I can see the Vanderbilts, the Stanfords and Mass Generals of the world, sort of addressing it well. You got the resources to. Is your typical family practice or primary care physician that's not at a tertiary medical center, do they have the experience or the communication channels agrees sufficiently that people listening to us, if they're feeling strange and they've had COVID, or maybe they didn't know they had COVID, can they go to their local doctors today and be confident that they have been educated about long COVID?
I think exactly not yet, because we in the academic medical centers are just learning about it, defining it better. And, the traditional way is we do the research, define what the issues are, provide some solutions, and then we communicate that out to the folks who are out there providing the direct patient care. And that process is underway, but we don't have enough. I think the average doctor knows about long COVID. I think they've probably, as individuals, still have not had enough experience working with a large number of patients. But this will come with time, particularly as we in academics get the information and disseminate it out to the folks who are close to the people.
Which really drives home the importance of medical science, academic medical centers today, the role that they play. They take a lot of heat today for prices and cost and charges and all. And every time I hear that, and that is a challenge for consumers and payers in the system, but the value of academic healthcare centers we're seeing play out over the last, year and a half in ways that we'd never thought, we couldn't have possibly imagined. I think that's just another example that's ongoing, that it really is the academic medical centers, people such as yourself, and the research dollars that are behind it, with the specifically trained scientists that are there.
So, Bill, let me just add a little bit to that, if I might, because I think one of the proudest things from the United States that we have contributed is the research. Remember, when COVID hit, we all opened up our textbooks to COVID and we found blank pages. There was nothing there. We learned nothing. The clinicians did their research, learning how to better recognize and take care of and test patients. The laboratorians began to work to understand the virus, developed diagnostic tests that they constantly improved, and appropriate treatments. Heck, we've been talking about the vaccines that were created in record time, remarkably safe and effective. And the public health research, learning how this virus was transmitted, where it was going, how it could spread, and the variants. The research that we've done, laboratory, clinical, and public health from the United States, that information spreading all over the world, that's been an enormously proud contribution. Others have contributed also, but we in the United States have contributed an enormous amount to the better care and prevention of COVID around the world.
That's so well said. A lot of people don't, and I really wasn't aware of it until I was in the Senate, that of our National Institutes of Health, which taxpayers support, and none of us like to pay taxes too much, but the NIH is funded by the taxpayer, by everybody listening to us right now, that about 70, and you can correct me, but 70 to 75% of that money that goes to the National Institutes of Health flows to the academic health centers, to the research places like Vanderbilt, to people like Dr. Shatner and others and your colleagues there. And it's just a nice cycle to see that the work's actually done by these local universities that are in communities that people are listening to, and the academic centers. And again, it's other countries don't have that. They just don't have it.
And it creates jobs.
Yeah.
For everybody who works in an academic medical center, and they go out and actually patronize all the stores and the restaurants and the concerts and everything else in communities.
Yeah.
So they're not only a research engine, but they're an economic engine also.
Yeah. I think Vanderbilt is, and Nashville, things are booming there. And, we got the music industry, and we got the healthcare industry, and we have the other 50% of other service industries and manufacturing. But Vanderbilt is the largest employer here in Middle Tennessee, and that gets translated throughout the economy here, and the job creation to the benefit of everybody, in addition to all the science. I can't help but, as we're sitting here, to go back. It was 15, 16 months ago, with the benefit of hindsight of where we are today and all the progress that you just cited in terms of what science has unfolded, what it has shared, and then the application of that science. What one thing do you know today about this virus that you say, good golly, I wish I'd known that back 15 months ago when I was talking to Bill Frist?
Well, Bill, that was so long ago. It's remarkable how much we've learned. But I guess if I had to focus on one thing, it would be the linked notion of exactly how contagious this virus is. We were just learning about that, and that it can throw off these variants that can become even more contagious, and how widely spread they are. Just reinforce the need for vaccines, and those vaccines they're giving us the opportunity to outrace the virus, to get ahead of it so that the virus is slowing down. Until we had the vaccines, all of our social distancing and mask wearing and avoiding large groups, that was helpful. But the vaccines really helped us catch up and get ahead of this virus. But we still need to vaccinate lots more people.
What sort of things do we not know? We spend a lot of time talking about the variants, so we know that there are going to be other variants. We know they'll have different lethality, or when you get them, how much you get hurt by them. And we know that transmissibility will vary with the variants. About the virus itself, what do we still not know about the virus? COVID, long COVID and things like that will unfold, but is there any one or two other things that we still don't know that will be coming?
Well, the pages are still blank and we're filling them in, but I would think the questions I get asked the most now have to do with the vaccines and the disease. Okay, doc, I've recovered from this virus. I had it. For how long am I protected? And I get that same question about the vaccines. I've gotten my 2 vaccines. Am I going to need a booster? And those are questions that are still being addressed. The need for boosters will be determined by 2 things. One, how long the protection is, and also, are there variants that can evade the protection we get from the vaccine? Any of those 2 things could lead to the need for a booster. Do I think down the road we probably will need a booster at some time? Yes. Do I know when? Not yet. Stay tuned.
You know, you, in addition to your being a professor at Vanderbilt, active clinically, active in research, active in communication, like we're doing today, you also serve as medical director and past president of a fantastic organization, the National Foundation for Infectious Diseases, or as you and I know it as NFIB. I think it was 2 or 3 months ago, NFIB held its annual conference on vaccinology research. Just looking at that, I just saw some of the reports coming out, but how has the field of vaccine research changed as a result of these miraculous vaccine breakthroughs? And what are some of the exciting progress, elements of progress that you're seeing?
Well, as you well know, Bill, basic laboratory investigations then bloom into products that can be used to treat and prevent illness. And so it is with vaccines. The scientific breakthroughs are great. We're on the verge of having a couple of new pneumonia vaccines. There are vaccines being developed that would prevent travelers from having traveler's diarrhea and this bug, Clostridium difficile, C. diff, that can complicate, people who are getting complicated medical care. There are vaccines there. And then, among others, there's still vaccines working against influenza. Our influenza vaccines are good, but not great. And there are people who are working on a universal influenza vaccine. That would be wonderful. And what has me really excited is people working on new ways to actually deliver vaccines. By that, I mean liberating vaccines from that jab, as the British call it, the needle and syringe. Suppose you could just have a patch that you put on your back or your shoulder and wear it for 3 days. Wow, we could revolutionize the delivery of vaccines. You wouldn't need people with letters after their name like MD and RN, expensive people, to give people inoculations. You could hire people, train them, and have them just go around and put a patch on people's arms or shoulders, and they would be vaccinated. There's somebody working on a research team, working on a capsule, which is the way to provide influenza vaccine. Wow, we could go door to door with those capsules and provide protection. So there are potential revolutions in the workings right now. We're not quite there yet, but that's the way science is. It looks ahead. It invests in the future.
I'm sitting here smiling because it is so exciting. And I had the privilege of working with you a lot in the transplant world and early on in terms of the heart and the lung transplant, the combined heart-lung transplant. And when you see science working, it makes you smile because of the speed, the rapidity, the impact that it does have when it's applied. And just listening to you, in a few weeks, we're going to have the CEO of Ginkgo Bioworks. And I'm really excited to do that discussion. Ginkgo Bioworks is a synthetic biology company founded by a few people from MIT 7 or 8 years ago, and they'll be listed as a public company here in a couple of months. But they really specialize in these delivery systems. And synthetic biology is basically creating an engineering manufacturing plant at the cellular level in each of your cells instead of a big factory over on the corner or out in the country. And it teaches your cells how to do all this without having all this external delivery systems coming in. So to our viewers and our listeners, we look forward to that because it's an extension of what Dr. Schaffner just said in terms of these delivery systems of the future, where the body itself does the manufacturing, and you train the body to do that. And for the last million years, we know that our body does a little bit better than things that we manufacture ourselves. So excited about that. Is that just you mentioned a lot of the diseases that could potentially have vaccines in the future. One that I've spent a lot of my time with over the years, both in the policy world and the medical world, is HIV. Why can't we get a vaccine for the HIV/AIDS virus?
Well, HIV has flummoxed us all, hasn't it, for the longest time? The holy grails for vaccines are malaria, thinking globally,
Right.
tuberculosis, HIV is right up there, influenza, and now even more COVID. So all of those together, it's one of the ones that we would like to do the most. Each virus is a little different. The laypersons often don't know that. They have their own personality. And HIV mutates so rapidly that it's been very hard to get a vaccine that would work against all of those variants. And people are still working on that. That's where, to use a lay term, we need a scientific breakthrough. We're not there yet, but we're not stopping. We're still trying.
Yeah, in my speaking and communication, and somebody gave it to me, but on the HIV, why can't we get a vaccine? They said, if you're sitting at a dinner table, there are 8 people around the table, and you take your napkin, your cloth napkin, and you, at the beginning, before you've used it, and you pass it to the next person, and they pass it as a ball to the next person, to the next person. It's constantly changing as you pass it. And you need some consistency there to be able to develop a vaccine. And I use that image because it's oversimplification. And that's one of the reasons it's hard to make a vaccine, but that's the challenge. And, you listed those 4, that's helpful to me, and to see the potential progress. Is there anything, Dr. Schaffner, about the mRNA? Most people, you and I spend our lives studying it, but most people have never heard of mRNA technology until, a year and a half ago. Is there anything unique about the mRNA vaccine technology that's going to help us address other diseases, just staying on mRNA?
Well, I think everybody has got a gleam in their eye who works in the laboratory. And once we can take a deep breath and get beyond COVID a little bit, I think you will see those research laboratories at the NIH and in the vaccine manufacturers, as well as in academic centers, try to apply the mRNA technology to provide other vaccines. There are people who are already working on trying to prevent Alzheimer's disease, not something we consider an infectious disease, but there may be a mechanism using mRNA to combat that. The 21st century is going to be blossoming with new innovations, right, regarding both treatment and prevention. I envy the medical students who are starting this fall at Vanderbilt. They are going to have a wonderfully exciting career ahead of them.
Isn't that true? People say, well, medicine's not that you can't practice it the way you used to practice, and all this loss of autonomy and all of this. That is, tiny in comparison to what you can look in those first-year medical students' eyes and tell them about the excitement of the science, the ability to grow, the ability to learn, and then translate it in a quick way to helping people and lifting their lives up. There's no more exciting time. I love it. I remember my dad telling me what an exciting time it would be, 50 years ago when I was much younger, but about thinking about medicine. And today you can even say that much more. What about everything else going on? I know the NFIB, which we referenced, has done a lot of survey work. So feel free to comment on that about other vaccinations. Should we get a flu vaccine? And one of the challenges of the pandemic is that a lot of preventive care that we would normally receive, whether it's cancer screenings or immunizations, dentistry, oral health, was put off, was delayed, and there have been negative health repercussions and childhood vaccination rates. Fill us in on what's happened there, and then also something about the flu vaccine, whether we should get it and when and timing and the like.
So on the positive side, telehealth was introduced en masse, right? And lots of doctors became familiar with it for the first time, as did their patients. And a lot of them liked it for many things. But one of the things we haven't learned to do is vaccinate you through the computer. That we can't do yet. You actually have to show up in person. And it was true, Bill. Unfortunately, during that shut-in period, vaccination rates, both in children and adults, plummeted. They're coming back up. The pediatricians, the family doctors, the internists are all trying to catch us up with those vaccinations. And the next time you see your doctor, I trust they'll do an immunization review to make sure that you're up to date. You mentioned flu. Yep. A lot of people have heard me talking about the need for COVID vaccine, and pretty soon you'll hear me nattering them again about getting their flu shots. We had a very, very low flu season last year, and that's because we were all locked up and wearing masks and staying socially distant. That really interrupted the transmission of that flu virus. But as you were saying before, we're opening up now. We're taking our masks off. We're getting out and about, which will provide the milieu, the environment for this flu virus to pick up steam again and start spreading. So starting in September, I do hope everyone will get their flu shot. The recommendations are easy. If you're older than 6 months of age in the United States, get vaccinated against flu each and every year.
Is there a vaccine registry right now? If I wanted to know, other than if I've gone to my local doctor, which I've done, and who I love, and I'll ask. In this case, it's a him. Is there a major vaccine registry for everybody in America that tells them what vaccines they've had and when?
There are state-based registries, Bill. They don't talk to each other very well, but there are state-based ones. They were put in place really to monitor infant, childhood, and adolescent vaccinations. COVID has stretched these registries so they take in COVID vaccines for adults also. And I hope that continues. One of the frustrations of doctors who care for adults is that the registries in many states still didn't encompass adult vaccinations. And doctors need that because people can get vaccines at the pharmacy, they can go to a clinic, they can get it at work sometimes. And so there isn't one common pathway where your doctor can look up and see where you've been vaccinated, except for the registries. We haven't supported those registries as completely as we ought to.
Yeah, I even wonder, I don't know, I know I need to get a pneumovax vaccine. Will that show up in a state? Will that be in my Tennessee registry if I did?
Our own state registry has been one of the ones that has not been very expansive to include adult vaccinations. So some of your information may be in the registry, but we can't depend on it that all of it is.
Yeah, we just need to figure that out. I mean, it just makes no sense. Now we're also sensitive to the importance of these vaccines and the fact that our policymakers can't take that and translate it into, and the funding for it. We just got to fix that. And it's just crazy. It's crazy.
That's an easy fix.
It's an easy fix, but it hadn't been done. It's just so many things, low-hanging fruit like that we just need to get together and just
need you back in the Senate to lead it.
No, exactly. No, it's the American people, Tennesseans just need to say, tell their policymakers, tell their people, their elected representatives that we need to do simple things like that. In our show notes, I just mentioned this. When I mentioned the NFIB research, there's a great poll that's been done on knowledge and attitudes on flu, the things we're talking about, and vaccination rate. That'll be in our show notes. So please go to wherever you're receiving this podcast or YouTube. In our show notes, you'll find that. Also, there's a consensus report out by NFIB, which we'll include there, talking about communications and how we can better achieve communications with the knowledge that we have and get it out to the American people so that we can affect change. The anti-vax movement, and I know we're running out of time here. There's so many things now that I have. You and I don't want to wait 15 months for our next show on this. Anti-vax movement, it's been one of the greatest threats to eradicating certain infectious diseases in the past. And in the United States Senate, I used to fight it a lot because at that time there was a huge public anti-vax movement. What about vaccine skepticism related to the COVID-19 vaccines? Increasing skepticism around childhood vaccines. Put that in perspective for us.
Well, it certainly is a caution, right? And fortunately, the grim anti-vax people are a very small number, but they're very intense and they're very good communicators. There are a lot of vaccine hesitant, skeptical, or folks who would like more knowledge. And I always say we have to do this one at a time. And the pediatricians and the family docs know this with the new moms and dads, and they come in with their little babies. Recognize and acknowledge that having some skepticism and hesitancy is normal. That makes the parent feel better. And then ask them what their issues are and respond in a helpful, positive way to those issues. Never disrespect the person who is asking the question. As I was told when I was younger, I was a very impatient person. Still am, as a matter of fact. You do catch more flies with honey than you do with vinegar.
You know, your ability to communicate and sharing just these obvious things, stressing the positive, listen with empathy, answer questions. It's so basic, but so fundamental, so important. It's why you're as good as you are, both as a teacher and teaching medical students and teaching residents, but also in communicating on issues like this. And I'm listening to you, and I know everybody is, in terms of the stressing the constructive and the positive and the listening and acknowledging that it is, natural to have questions about vaccines. I think it's critically important messaging. So really appreciate that. Is the I guess we'd sort of jump to the future a little bit. When another pandemic occurs, and viruses have been around for thousands, hundreds of thousands, millions of years, and move a lot quicker than we do, and are always moving. And we're going to see another pandemic coming forward. What should we do differently? I know we've learned a million things, but give me two or three that I can tuck away in my head as we close up the interview.
Well, you will anticipate what I'm going to say, Bill. I think if you had asked many of us in public health and infectious diseases before COVID what the single most important response is if there is a pandemic, and we would have put clear, sustained, science-based communication at the top of the list. You have to let people know what's going on honestly and clearly, and let them know that we're going to learn more with time. So please stay tuned, because we're going to have to modify what it is that we've told you. Number two, put those public health people in the front and have the politicians standing back and supporting public health. Let's be a team working together, public health and politicians. And I think those are recipes for success. Clear communication and doing science-based responses. And lastly, for those of us in the United States, we need a national response. We can't give it to each of the states to do something differently, because then you get a hodgepodge. I think we need a national response, science-based, clear communication. I think it's a winning formula.
You know, those three things, if we can just imprint those and keep reminding people and then pulling them out and you know, jumpstart this whole learning curve or forget this learning curve because you already have it for this next pandemic, which will occur in some shape or form. Lastly, let me just close with a question. We've all been so focused on COVID, and appropriately so, and our response to it and the science behind it and where we are in terms of the ongoing pandemic and what our response is, and learning about new things like the Delta variants, other variants, long COVID, the things we've talked about. Putting all of that aside, what else? Is there anything else in the world of infectious disease, preventive medicine that we could leave our listeners with?
I would think of two things that are immediate and then one larger thing. The immediate things are, we've mentioned it already, get your flu shot because flu is coming back and it's also a nasty virus. Number two, COVID has put the opioid epidemic and all of its ills to the side. We've kind of forgotten it, but it's still out there. And that's a large problem we still need to address. We haven't done that effectively. And then the overarching problem is climate change. That, beyond anything else, is a huge threat to the world's population and the way we live. We've all the nations of the world have got to do a better job controlling the emissions that are resulting in climate change.
Dr. Schaffner, thank you for being with us. I love the way you're closing, because I purposely wanted to separate and see what you would come up with in terms of the issues outside of COVID that scientists are working on, that we're making progress on, that we need to continue making progress on, and climate change, which has been a partisan issue in the past 15 years. A fellow Tennessean, Al Gore, when you know first started talking about it, you know, not a lot of followers coming in, but you know, here we are, several decades, three decades later, and it is the large existential threat that we all will have to address. We all, regardless of where we are in politics and partisan and language and history and wherever we are, this continuity of personkind, of history, means that all of us are going to have to pay attention. All of us are going to have to learn. All of us are going to have to pitch in on this truly existential threat that is out there. Bill, thank you so much. We started with where we were 15 months ago in our last formal conversation here, and sort of finished on looking way ahead into the future. But look forward to having you once again, many times again, with our people on a second opinion as we go forward. Thanks for all of your leadership, and thanks for being with us today.
Always a pleasure to be with you.
This episode of A Second Opinion was produced by Todd Schlosser and the Modus Creative Group. You can subscribe to A Second Opinion on Apple Podcast or wherever you are listening right now. And be sure to rate and review A Second Opinion so we can continue to bring you great content. You can get more information about the show, its guests, and sponsors at asecondopinionpodcast.com. A Second Opinion broadcast from Nashville, Tennessee, Music City, USA, the nation's premier ecosystem of health services, where we engage at the intersection of policy, medicine, and innovation.